A senior minister has warned that a third spike of coronavirus infections is possible as the government seeks to win over Conservative MPs unhappy with its plans for the system that would replace the England lockdown this week. Most areas will be placed into the top 2 tiers of restrictions. The government says it is listening to the criticism and will publish an analysis tomorrow to support the measures. With the vote due in the House of Commons on Tuesday, here's our political correspondent Iain Watson.
It's been difficult finding cheer in this festive season. In Glaisbury and Greater Manchester, they've been living under some form of restrictions since the summer. And what's even more cutting is they'll be placed in Tier 3, the highest form of restrictions, from next week.
If you look at some of the figures and things like that, if you study it, they seem to have cracked down a bit hard on Greater Manchester, in my opinion. So,
just speaking amongst the people, they seem to be kind of fed up.
But some are putting a brave face in it.
We've got to be careful. If we're all sensible, it'll all end soon enough. Not this year.
The season of goodwill hasn't extended to Westminster. Boris Johnson's facing a growing rebellion in his own ranks. Ministers haven't ruled out a third lockdown, but they say new restrictions are the best way to avoid this, and that they'll reach out to those MPs who have concerns.
MPs say to me, we just want to understand that the measures you're taking take into account not just the cost and benefit of tackling the virus, but also the non-COVID health, economic and social implications. We'll publish more analysis on that. And we do take seriously the principle of parliamentary accountability.
And the Prime Minister himself has written to MPs to say that if they back him this week, he'll give them a new vote on the restrictions on January the 27th. If they don't support them then, the restrictions would end on February the 3rd. And he says a review of restrictions next month means that some areas could come out of Tier 3 on December the 19th, though that will depend on the evidence. Apparently, there is smoke without fire at Westminster because some very vocal potential rebels now say they'll back the government in Tuesday's crucial vote on the restrictions. But for others, the Prime Minister hasn't gone far enough.
It's absolutely right that MPs are scrutinising what the government does. That is their job. All the more important to take place during and enduring emergency. And we have a couple of days to get this right, to advance what's going on. Concessions have been made, but I would like to see more.
Now, you may have to just pinch yourself a little, because wasn't it just a year ago that Boris Johnson won a stonking 80-seat majority? Yet such is the level of unease with the new restrictions he wants to introduce in England that he's going to have to meet a whole range of MPs tomorrow to try to keep them on side. What he wants to avoid at all costs is relying on Labour votes to get his new measures through Parliament, because their support would come at a price.
The reason that I'm not committing to vote for these measures is because we're not convinced at the moment that they are either sufficient or workable. It's not too late for the government to convince us of that.
Political pressures have led the Prime Minister to concede a new vote on his measures in January, so at best he may be postponing a rebellion beyond Christmas rather than avoiding it entirely. Now, Mishal, the contents of one document could determine the size of this week's Conservative rebellion, because tomorrow the government is conceding a key rebel demand to produce an assessment of the social and economic impact of their measures. Or, to put it very, very crudely, MPs want to know whether saving lives will outweigh the damage that these restrictions will cause to livelihoods. Now, speaking to some of the potential rebels tonight, it looks as though they're willing to be convinced by the government, but they say they're withholding their support until they see the hard data behind Boris Johnson's decisions.
Iain, thank you very much. Iain Watson there at Westminster. Well, the latest government figures show that there were 12,155 new coronavirus infections recorded in the latest 24-hour period. That takes the average number of new cases reported per day in the last week to 15,224. 1,524 people have been admitted to hospital on average each day over the week to last Wednesday. Another 215 deaths have been reported. That's people who died within 28 days of a positive COVID-19 test. It means an average of 460 deaths per day in the last week. The total number of UK deaths is now 58,245. Another 2 million doses of the Moderna coronavirus vaccine have been bought by the government. It's one of the 3 that are being put forward for regulatory approval after their clinical trials. But when might the first vaccinations take place? Here's our science editor, David Shukman.
There's so much talk about vaccines, it's easy to lose track of what's going on. So here's what we know so far. The government has ordered 357 million doses of 7 different vaccines, though crucially, none has been approved for use so far. Here's the list of those 7 and the numbers of doses ordered. Of these, the Oxford AstraZeneca vaccine has now been sent to the regulators, the MHRA, for approval, and they're going through the data right now. But the BioNTech Pfizer vaccine was the first to start that process, and it's possible we'll get an answer on that very soon.
My understanding is that there's been quite an interactive process with the regulators whilst these trials have been going on, so they have actually had sight of a lot of the information ahead of time. I wouldn't be too surprised if an announcement would be made within the next 2 weeks, possibly even as early as next week, but we'll have to wait and see. You know, it mustn't be rushed, it has to be safe.
So what are the regulators looking for? Well, 3 things: safety, quality, and effectiveness. And of these 3, the regulators keep emphasising the safety of the public must always come first. So they're working fast but carefully, because the worst thing would be for doubts to start creeping in about these new vaccines. Now, doses are already being manufactured in the hope that approval is given, so everything hinges on that coming through. So when might we start to see the benefits? Well, if that approval is given next month, it's possible that the first doses could be administered ahead of Christmas, though people will need 2 injections a month apart, so they won't get immunity straight away. Beyond that, the government hopes that by next spring to have vaccinated the most vulnerable people, such as residents of care homes and health and care workers, but everything hinges on distribution and production on a massive scale, and that's a huge challenge.
David Shukman, our science editor, reporting there.